Lesson 22. Physiological changes and benefits of exercise. In this lesson, we will discuss physiological changes that happen with age and the benefits of exercise for the older adult. At the end of this lesson, you will be able to outline the physiological changes that occur with aging and describe the physiological and psychological benefits of regular exercise to the older adult. As we age, various physiological changes occur in our bodies. VO2 max is reduced. VO2 max is the maximum amount of oxygen that our bodies can use during maximal exercise. It is estimated that once we go over the age of 25, there is about an 8 to 10% reduction in VO2 max every decade. Cardiac output is reduced. Cardiac output is the amount of blood that the heart can pump around the body in 1 minute. By the age of 65, it is reduced by about 20 to 30%. Blood vessels become inelastic. This can be a natural process of aging, or it could be because of deposits of plaque, and we discussed plaque when we were talking about coronary heart disease. Our maximum heart rate decreases. If we use the calculation 220 minus our age to calculate maximum heart rate, you can see then that the older we get, the lower our maximum heart rate becomes. Respiratory changes. Vital lung capacity reduces. This is the maximum amount of air that a person can expel from their lungs after taking a deep breath. Chest wall compliance also reduces, and this is the ability of the lungs to stretch and expand. And alveolar size decreases. Alveoli are the tiny air sacs that are found within the lung. Body fat increases. This is largely related to the fact that our metabolism reduces as we age, and this is brought about by the fact that our muscle mass decreases. Muscle is more metabolically active, so the more muscle we have, the more calories we burn. As we lose muscle mass, our metabolism also drops. In addition to our metabolism dropping, our strength will also be reduced, particularly in the lower body. There's a loss in bone mass. Bone is constantly being renewed or remodeled. Old bone is being removed and it's being replaced by new bone, or new bone is being laid down. As we get older, more bone is being taken away than is being replaced. So as a result of this, bone mass reduces. Connective tissue loses its elasticity, muscle fibers shorten, and the joints produce less synovial fluid. This means that our joints tend to become stiffer and our range of motion decreases. There's a reduction in nerve conduction and the number of neurons and brain mass. Nerves are responsible for bringing messages from the brain to the various parts of the body. If there is a reduction in nerve conduction, and this is going to affect our reaction times. So our reaction times tend to slow down. There's a reduction in hemoglobin. Hemoglobin is the component of blood that gives blood its red colour, but it's also responsible for carrying oxygen. So the reduction in hemoglobin also contributes towards the fact that as we get older, our VO2 max decreases. Total cholesterol increases, and our HDLs, that's our good cholesterol, reduces. Balance, taste, sight, and hearing can all become impaired. This could also contribute towards the client becoming less active, as if they are having a difficulty with balance, they may have a fear of falls, and if their sight or hearing has become impaired, It can lead to them becoming more vulnerable, and as a result, they may not have the confidence to participate in activity. It is thought that as much as 50% of the functional decline seen in ageing is related to disuse, and much of this decline could be prevented with regular exercise. The ageing process varies widely between people, and it's influenced both by lifestyle and genetic factors. Exercise, diet, smoking, and other health habits have a strong effect on improving both the length and quality of life. The benefits of physical activity. Regular physical activity is important for both the primary and secondary prevention of many chronic diseases, such as coronary heart disease, adult onset diabetes, disabling conditions like osteoporosis, and chronic disease risk factors like high blood pressure and obesity. By primary prevention, we mean preventing the condition from developing in the first place. And by secondary prevention, we mean reducing the impact of the condition once it has occurred. Regular physical activity substantially delays the onset of functional limitations. It has been reported that inactive, non-smoking women at age 65 have a 12.7 years of active life expectancy, compared with 18.4 years for highly active, non-smoking women. Exercise is recommended, especially balance exercises, for the prevention of falls. One study reported a 58% reduction in falls among older women who began an exercise program. Physical activity is also recommended in the management of arthritis. One study reported that regular walking reduced pain and improved function among people with arthritis in their knees. Evidence suggests that regular physical activity can improve the quality of sleep among older adults. Physical activity often reduces symptoms of depression. One study found that strength training was as effective as medication in reducing depressive symptoms among older adults. Physical activity has been shown to reduce the amount of cognitive decline often associated with ageing. Exercise also helps to increase bone density and prevent osteoporosis. It can help to increase muscle mass and metabolism, which contribute to body fat management. It can create a sense of belonging through social interaction and improve pulmonary function, which usually declines with age. Exercise reduces the amount of vertebral degeneration and increases the strength of the thoracic cavity or the chest cavity, which in turn improves pulmonary function. It can help to prevent and regulate non-insulin dependent diabetes by regulating blood sugar levels. It improves flexibility and joint range of motion. It can improve blood circulation and improve cardiovascular strength and endurance.